I'm Dr. Augustin with Bayside Chiropractic and Rehab, and last week we talked a little bit about an example patient. The patient was experiencing severe low back pain from a slip disc, or sometimes called a bulging or herniated disc, with sciatic pain, and we walked you through the process of what treatments we use to try to get the patient out of the pain and moving again. We talked about if he needed pain relief, that sometimes medications are appropriate if we can't do the treatments because he's so severely limited in his motion that sometimes in the first 48 hours we do have to get some medication, and we work with the patient's general physician in that. And then we go through the treatments like decompression, cold laser therapy, adjusting, stim ultrasound. And then we got to the end of that session where it was about 3 weeks into treatment, which is usually the amount of time I give a herniated disc to start resolving, or at least the pain to be greatly reduced. At that point, we start the patient on a type of rehab program so that these events don't happen in the future. And one of the things that we really want to start is we use certain nutritionals, exercises, and we also do weight loss. The first thing I'll talk about is a few nutritionals. The worst thing that we could do is take a bunch of non-steroidal anti-inflammatories for prolonged periods of time because they're hard on your stomach and gut. They can cause ulcers over prolonged use. So there's nothing wrong with using them, but you don't want to be using them every day for years and years and years if you can avoid it. So what we do is we start with different supplements, and some of them, like I love curcumin, which is from the herb turmeric. A lot of people use this already. This is just the active ingredient, which is basically a lot more potent than just using turmeric. It's a very good anti-inflammatory that's used in India and other places, and is used as an anti-inflammatory without all the side effects. Often I'll use something like B6, which is also shown to have great anti-inflammatory properties. I've got different forms of curcumin that which I'll see depending on the pain levels which one's more appropriate. I also have some specialized products, which one of them is Ligaplex 1, which isn't going to mean a whole lot to you, but it was designed by a company that's been in business for over 100 years, and it's designed especially for disc type injuries to help reestablish, integrity and reduce further episodes. The second thing I'd like to talk about is we also have, in our example, we said the patient was 20-30 pounds overweight. Well, one of the best ways you can avoid low back issues in the future is to get rid of that excess weight. And we have a weight loss program that, there's no stimulants, there's no amphetamine type, stuff that will make you feel jittery. It's a specific type of diet. Everything's store-bought, so you're buying vegetables, fruits, and stuff like you would on a regular shopping day. There are some nutritionals which are included, and then weekly appointments to see your progress, and also to weigh you in and to answer any questions, and if for some reason you're not doing as well, to alter the program for you. And it's a 6-week program. Average weight loss on women can be anywhere between 17 and 25 pounds. Males tend to do a little better, maybe 23 to 30 pounds, which in 6 weeks is significant. You can look into other weight loss programs and you'll find that that's a pretty significant weight loss. And that's just to help limit the amount of stress on your low back. The other thing I like to talk about, and we sit down when you have the ability, is start talking about lumbar exercises, stretching, strengthening programs. And there is a difference. When you talk about exercises, they kind of fall into different categories. Initially, we like to use stretching just because your back, you don't want to do a whole lot of strengthening at that point because your back's still recovering. So what we do is specific lumbar stretches depending on how the disc was herniated, depending on what your symptoms are, how the loss of range of motion was in your low back, whether you can't stand up straight, whether you can't bend forward, and you have different stretches associated with that. So we start with that. And then I like to talk about something that everybody uses this word, and it's core exercises. And when we say core exercises, what we're talking about is stabilization of the lower back. In other words, we're trying to strengthen these areas that take pressure off your low back. In other words, so you're not putting more pressure on your low back. So some of the things we do is look at abdominal muscles. If you have stronger abdominal muscles, then obviously your back doesn't have to support your weight as much as it would with weak abdominals. And then specific exercises fall in that. I like an exercise called planking because you're not doing a whole lot of motion, so there's less chance of injury. It's very hard to do it wrong, which is a problem when people are going to the gym. If you're doing exercises wrong, you run the increased risk of injury. So you want to pick simple exercises that everybody that can do that's really hard to get wrong. Pelvic tilts, gluteal bridges, these are just some examples of what we use to stabilize the low back. Then when we go through that, then you can start into a strengthening program. Now, what we look at as strengthening is we want to strengthen the area up, and that's when you get into more, you're looking at the low back to help maintain the tone of your musculature to support your low back. I don't like starting with those because if the back has already been injured, the last thing you want to do is put it under a lot of pressure with these strengthening exercises, because you run the risk of having more injury. With these things, so again, we use nutrition, weight loss, exercises. We've grouped them into 3 different kinds: stretching, core, and strengthening. And then if you do all of this, if you're a compliant patient and you do all of that, you really decrease the risk of further episodes. So often I hear, this all started about 10 years ago. I put my back out, and ever since then, every 6 months I have, a reoccurrence. It lasts so many weeks, and then over years they keep getting shorter. There's shorter time in between, so it's every 6 months, then it's every 5 months, then it's every 3, 2, and then once a month I'm having some kind of problem with your back. So if you do this type of complete stabilization type program, the risk becomes a lot less to have these incidents that occur in the future. And that's the whole goal. You don't just want to alleviate symptoms just to have them 6 months later. You want to decrease the back pain, recover, and you don't want to have future problems. And we also talk about maintenance programs, because it's a good idea to be in some kind of maintenance, just like you go to the dentist every 6 months to have your teeth cleaned to avoid cavities. You want to do a similar thing, to maintain your back, because you use it every day. Actually, you use it a lot more than your teeth. So if you have any questions, don't hesitate to call my office. My number is 251-990-8388. Again, I'm Dr. Christian Augustin with Bayside Chiropractic and Rehab. Be happy, be healthy. Thank you.